Hi, my name is Sarah Coble, and this is my presentation on my internship at Atrium Health Stanley in the Behavioral Health Unit. We are located at 301 Yadkin Street in Albemarle, North Carolina, which is about an hour and 15 minutes from campus. My site supervisor, Ashley Moore, has worked at Atrium Health Stanley for 11 years and has worked in mental health for 13. She's currently the only recreational therapist in our unit. Our unit has 12 patients consistently that range from ages 18 to 65. The population that we serve are those going through a mental health crisis that are at risk to harm themselves or others. We treat people with anxiety, depression, bipolar disorder, alcohol use disorder, and schizophrenia. When many patients come in, they have dual diagnosis, which can include someone that has auditory hallucinations coming in that have caused depression. So we treat the auditory hallucinations as well as the depression while they're there. So we hope that those hallucinations minimize and that their depression gets better by the time they are discharged. There are many services provided by our behavioral health unit, which include social work. So our social workers are actual psychotherapists that hold group sessions, family sessions, and provide individual assistance for patients. They give the patients the resources they need while they're here at the hospital to get primary care appointments and therapy appointments post-discharge. So this really helps the patients have somewhere to go after they leave, so they are not just leaving without any resources for their mental health. We also have psychiatry. They help regulate the patient's medications and make sure that the dosages are correct, or if the patient needs medication changed altogether, they also do that. So the nursing staff also ensures the patients they are taking their meds on time and making sure that they're safe while they're on the unit. We offer chaplain services as well if a patient decides that they need some religious advice or some spiritual counseling, that he is there for them during that time. He also holds a group once a week on Wednesdays where he can hold sessions on forgiveness, guilt, and anger management. So we also have pet therapy that is through our department. Recreational therapy is run by my supervisor, and they come 2 to 3 times a week depending on the availability of the owners. We have to make sure that the dogs have had their shots, have had baths, are up to date on everything just due to our facilities protocol. So we get a binder that talks about all of those requirements, and we get the owners to sign off on them before they leave. So these dogs come in and allow the patients to pet them, love on them, and just give them all the attention that they like. And it helps with the patient's depressive symptoms, their anxiety, and just overall mood. It kind of boosts everyone's mood after the dogs leave. And of course, we offer recreational therapy services where we display the APIDE process on a daily basis and just implement 2 groups of activities and discussions daily. So now we have a little day in the life of the internship here. I usually begin my day at 8:15, start it by looking over patient charts to see if anything significant happened overnight while we are gone. This also allows an opportunity to look at any new patients that we have on the unit and see what brought them to the hospital and then anything important in there. After we look over the patient charts, we go to our daily rounds meeting with the treatment team. This includes social work, nursing, psychiatry. Anyone that is a part of that is in there. We go over anything significant about the patients, any important information that they may have in their different disciplines. We normally go last in our treatment team meeting just to let them know that patients are coming to group, or if patients aren't coming to group, or any different behaviors that they're exhibiting during those group sessions. So that's a great time just to kind of advocate for the patient and just tell them how they're feeling from your point of view, and just what they've told you during group sessions. So it's very good for that as well. Next, we begin to plan for our 10 o'clock group session. This can either be held in the day room or in the dining room, just depending on the activity. Typically, for the day room, we do more discussion-based activities or things like that. And then in the dining room, we do more things if you have to write on the table, or maybe it's like a board game, stuff like that. It's better to do on those nice tables that we got. So those are both pictured in the slide there, just for you guys to look at and see all the different things that we have there as well. During our morning group, we typically do more educational or discussion-based activities. This gives us the opportunity to gain insight into our patients' thinking, just to see if they're reaching their treatment goals, which is always good to see how they respond to different activities and see what interests them the most. After a group is over, I go and document that group session. I just let them know what kind of group it was, what the purpose was, and how everything went. It's really good for the treatment team to go back and read and see if patients participated in the group, how they participated, and then how they interacted with other patients as well is very good to see and gauge how they are responding to treatment and just to see how they enjoy group. After that, I go and assess new patients. Our in-house assessment helps us build up patient rapport, create a goal and intervention for their treatment. We have an in-house assessment, like I said. This is created by a recreational therapist for specifically Atrium Health. It gives like a leisure inventory, goes through some self-esteem questions, like if you could change something about yourself, what would it be? Different things, just see what they like to do for fun and how we can better treat them and serve them. And just it asks them to give a goal for their treatment as well, so it kind of gives them something to think about while they're there, just to give them something to look forward to and work towards while they're in the hospital. During this free time, we go and chat with the patients and just see what they're up to, ask if they need any other recreational supplies. We have different board games and cards and different crafts in a cabinet that really give them something to do while they're there. We check the supplies that we have to make sure none of it is damaged and make sure it's organized. That's in the picture down in the bottom. It has coloring books, word searches, Sudoku, origami, anything that they could think of is in that box. We have markers, crayons, checkers, chess, and Uno. Everything is in those boxes down there, and we just make sure everything's not damaged and anything that needs to be taken out can be taken out. It was just an opportunity just to kind of go chat with the patients, see what they're up to, and just see what they're enjoying doing while they're here. Next, we have our 2:30 group session. This is much more of an activities-based group, such as basketball, cornhole, card games, board games, so much more. This challenges the patients to be more active and challenge their minds. To finish off the day, we also make sure all of our progress notes have been completed, since we have to complete them every 7 days. Patients on the unit, that's definitely part of our protocol that we need to do as our recreational therapy goals and outcomes and stuff like that. So we just make sure those progress notes are in and just make sure that the patients know that they will be here another couple days after that. And once I ensure everything is completed, that concludes our day in the life of the internship. What attracted me to Atrium Health Stanley was working with a population I had never worked with before. Due to the high turnover rate of 5 to 7 days of the patients being there, every day is different, so you get to see new faces every day, which is very fun, and you get to know new people. There's always someone new to me, which really excited me about this internship. Since there are so many new faces, there are many opportunities to learn from the different medications people are on and like what those do and the different things they treat and the side effects that they have with those. Being able to continually learn is something I've really enjoyed during my time here. Being an advocate for patients when they're unable to speak, is very special to me. We had a patient become very overstimulated during group and left because it was too loud, so I had learned in a previous group that loud noises and people talking over each other was very stressful for him. So when someone had mentioned that he didn't participate in the group activity, I was able to inform them of that stressor that he had, and that was the reason he stepped out of the group activity. So when patients don't come to a group, it is looked like they're trying to isolate themselves and not participate in treatment, which hinders their discharge, which I think being able to advocate for him in that way was very important, just to let them know that he was very stressed and did not feel comfortable being in that group activity. I work alongside my site supervisor in such a supportive environment. She supports me in any idea I have for group activity and lets me do them. She's there for assistance and advice when groups don't go as I had thought they would go, and she thinks idea could not be the best opportunity for these patients. She lets me know and helps me adapt and move on from those as well. Overall, she wants me to succeed and will do anything to ensure that, which is very, very important. During my orientation, she did a great job at showing me the flow of the unit and how we are supposed to do our documentation and the various policies that go along with that. My first 2 weeks, I was able to shadow her to see how the flow of groups went and how she facilitated various activities. I was able to here and there do a group just to see how I was doing and see if we needed to shadow a little longer, but everything went really smoothly and I was able to start up doing my own patients and assessments very quickly after we did the shadowing. This was such a great opportunity for me since I'm a visual learner, so being able to see what I'm supposed to do has helped me a lot in my facilitation techniques, just to see how I need to handle certain situations and how I just need to lead the groups was very important. So being in such a supportive and helpful environment really ensured the success of my group activities. This agency does have practicum opportunities available for students. However, there is no set application process. When I applied, I emailed Ashley asking if they were still holding internship opportunities, to which she replied to send my resume and cover letter. So once I sent those in, she reviewed them. We had an in-person interview just to see the unit and go over job responsibilities. Any questions I may have had, I asked them there. Once you have accepted the internship, you take orientation classes for patient confidentiality, diversity and inclusion, and the personal protective equipment for different diseases and stuff like that. So it's very important just to learn those while you're there. There is also a needed recent TB skin test, drug screen, and background check. Unfortunately, the agency does not offer benefits such as paid drug screen or background check. So if you need any additional resources, please reach out to your advisor just to express those concerns and see if there's any resources for you there. Some essential strengths that are important to have for this internship is creativity. Being able to think of different ideas for group activities and how to implement them can be beneficial. Having communication skills is also beneficial in several aspects, such as documentation. Being able to communicate professionally on how the patient has performed in group activities and being able to communicate their needs to the rest of the treatment team is very important, just to advocate for them as well. Skills like problem solving and assertiveness kind of go hand in hand in this internship. When some patients begin testing boundaries during group times, it is important to have quick problem solving skills and the assertiveness to reset the boundaries that have been challenged. So in every helping profession, skills like compassion, empathy, and patience are very much needed. These skills ensure that you are giving the patients the best care possible, makes them feel seen and cared for. Lastly, we have time management skills. This is important to ensure that you're able to complete all your assignments on time daily. Most of these skills I have learned over time through volunteer opportunities at UNCG, but things I've worked on more in my internship was my assertiveness. I'm a very soft-spoken person, so when it comes to telling people what to do and saying no, I have always had a hard time doing that. Over the course of my internship, I feel like I've improved greatly with my leadership abilities as well as being assertive when I need to be. If you're interested in working in behavioral health, I definitely recommend doing some research on these types of facilities and how the population is served. You can do this by volunteering in mental health facilities or different programs. This will help you become familiar with the population and to see if it's a good fit for you. When coming for your interview, I would definitely come prepared with questions that you may have and how the APIDE process is done in this facility and how documentation process and goals differ from other facilities and populations. Working in an inpatient behavioral health unit is definitely not what you think. Most of the time, people have already made their assumptions and biases about what this unit would look like from media such as TV and movies. It is not nearly as extreme as Hollywood portrays, and at times it can be a pretty relaxed environment. So I would definitely recommend leaving any biases or assumptions that you may have behind when you go to this facility, because it is definitely not nearly as extreme as Hollywood makes it out to be. I would also suggest taking the mental health first aid class before you go. It really helped me understand how to help someone in a crisis and understand signs to look out for when speaking to someone. Lastly, make sure you are also taking time for yourself as well. This job can be very demanding and emotionally taxing on your mental health as well. So just make sure you are taking care of yourself by allowing yourself to rest when you need to and not overworking yourself, and just have fun. That is the end of my presentation. I hope you have learned something new about the Behavioral Health Unit at Atrium Health Stanley and decide to reach out about internship and practicum opportunities. I hope you have a great day, and just if you have any questions, feel free to email me or Ashley. She would love to answer any questions you may have about the unit. Thanks.